show the first presentation of the big system is developing computer-aided diagnostic system for classification of malignant grade tumor graded in ultrasound imaging, presented by Yang Cheng-Liang from Department of Bioindustrial Mechatronics Engineering, National Taiwan University of Taiwan.
My name is Cheng-Liang. I will talk about my research. The title of the research is developing a computer-aided diagnosis system for classification of malignant tumor, breast tumor grade, and ultrasound. Breast cancer is commonest cancer in women. The lower right picture shows a woman who has breast cancer. This map shows the mortality rate of breast cancer around the world. In 2008, the breast cancer causes 400,000 deaths, so we should focus more on it. This is the outline of the study. First, I will talk about the breast cancer and tumor grading system, and then I will introduce the objective and procedure of the study. Finally, I will show you the results and conclusions. So, what is breast cancer? The left picture shows the process of cell division. The normal cell can grow and divide to form a new cell. When normal cells grow old or get damaged, like this green cell, they will die, and other cells can take their place. But sometimes this process goes wrong because the DNA of the cell can become damaged or changed, like the picture below. It may cause the cells to duplicate. So the extra cells may form a mass. We call the mass as a tumor. If cells in a tumor can invade the neighbor cells, we regard the tumor as a malignant tumor. Tumor grade is an indicator of how quickly a tumor is likely to grow and spread. It can provide clinical information for doctor to plan a treatment of the patient. Tumor grading system is used to determine the tumor grade. This system is based on following features: tubule formation, nuclear grade, and metastatic grade. The right picture shows the appearance of cancer cells in microscope. A pathologist will check the appearance to evaluate the score in each feature. Each feature is scored from 1 to 3. So the pathologist will add the 3 feature scores together to determine the tumor grade, like this table. If a tumor is high grade, the tumor can grow and spread quickly. So a patient with a high grade tumor require more aggressive treatment. So, but there is a question: how to obtain the cancer cell from patient's breast? In traditional way, the doctor uses biopsy method to obtain the cancer cell. This method is inserting a needle to breast, like this picture. But this method is invasive and distressing for patients, and it is time-consuming to get a report about tumor grade. But ultrasound imaging has many advantages. It is non-invasive and real-time. In fact, most patients can continue a normal life with early treatment. So, if we can provide information about tumor grade immediately, the doctor can plan the treatment earlier. So, in this study, the objectives are to non-invasively determine malignant tumor grade by using ultrasound imaging to quantify the characteristic of the tumor for diagnosis and to develop a CAD system for classification of breast tumor grade. This is a procedure of the study. First, we obtain the three-dimensional ultrasound image from patients. Second, we segment the tumor from ultrasound image, and then we define textual, morphological, and electrolytic features to describe the characteristic of the tumor. And fourth, we use support vector machine to classify the tumor grade. And finally, we use receiver athletic characteristic analysis to evaluate the performance of this system. This slide shows the ultrasound imaging system we use. The slide shows the statistics of image data. The table shows the number of tumors in different grades. In this study, we regard grade 1 and grade 2 as low grade, and we regard grade 3 as high grade. So the number of low grade is 119, and high grade and the number of high grade is 29. So in this study, we want to build a classifier. It can distinguish the tumors between low grade and high grade. In image segmentation, the left picture shows a three-dimensional ultrasound image. The blue line shows the tumor region. After obtaining the image, first thing we have to do is segment the tumor from its background. Typical segmentation is done manually. That means you have to do it in two-dimensional approach. So with three-dimensional image, it is time-consuming to find the contour of the tumor. So in this study, we perform semi-automatic segmentation in three-dimensional image. It is done by level set algorithm with the software IPSNet. The right picture shows the tumor after segmentation. We use 14 features to describe the characteristics of the tumor. They include patient's age, 6 morphological features, 9 electrolytic features, and 24 textual features. Morphological features are used to describe the shape of the tumor. They include volume, surface area, radius, speculation, classical components, and discrete components. In electrolytic features, for the malignant tumor, their shapes are irregular. So we find an electrolyte to best fit the tumor and compare those two, the tumor and the electrolyte. The right picture in right picture, the red region is tumor and the red region is electrolyte. We use we use 9 features to describe their differences. In textual features, in right picture, there are 2 different tumors. Under the picture, the tumor is brighter than the other one. So we use the textual features to quantify the differences. We use Chien features to quantify textual features. We calculate six features in textual feature. But in this study, we set 4 vectors in 3-dimensional image. So there are 24 textual features used in this study. In classification, we use the topographic machine to build a model to classify tumor grades. We choose radial basic function for my kernel. And we use 3D search and cross-validation to choose appropriate margin and kernel parameter to obtain the best accuracy. In performance evaluation, we use RC analysis to evaluate the performance of the proposed system. They include 6 indices. So this slide shows the results. The gray line shows the confusion matrix from classification of low and high grade. And the 6 indices will can be calculated from this formula and be shown around the table. The accuracy of the system is 75%, but some indices are not to expectation, just like PPT and sensitivity. So we will able to improve the performance. In conclusion, in this study, we proposed a CAD system to classify the tumor grade, and the accuracy of this system was 75%. In the future work, we will quantify other features or implement feature selection to improve the performance. Thank you for your attention.
Really interesting presentation about breast cancer. So, with someone have any question or comment about this presentation? So I have one question. Let me show the last 3 slides. Yeah, this one. The accuracy is 75%. Is it insufficient or insufficient to be done? And we have the accuracy only 75%. Is it sufficient or not sufficient? Is it okay? Not 100%, just only 75%. Yes, the accuracy is just 75%.
Yeah.
Is it okay enough or not enough? You need to include the accuracy much more. How do you improve?
In visual complication, we think many features are redundant. So I think we will perform the feature selection to select the important features.
I hope.